My name is Hannah and I'm from SMK Sri Lalang Klong. Today, I'm gonna share my thoughts on why vaccination is important during COVID-19 pandemic. Vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. Vaccine typically contains an agent that resembles a disease-causing microorganism and is often made from weakened or kill forms of the microbe, its toxins, one of its surface proteins. The first vaccine was developed by Edward Jenner in 1796 for smallpox. We need to keep ourselves vaccinated to protect everyone. The more people in the community who are vaccinated, the harder it is for a disease to spread. If a person is infected with the disease, comes in contact only with the people who are immune, the disease will have little opportunity to spread. The type of protection created when most people are vaccinated is called herd immunity. It means that many of us are protecting each other, especially the most vulnerable among us, such as babies who are too young to be fully vaccinated, people who cannot receive certain vaccines for medical reasons, and people who may not adequately respond to immunization, such as elders with poor immune systems. When vaccination rates drop in community, it's easier for a disease to spread and cause an outbreak. Some parents who decide not to vaccinate may believe that herd immunity will protect their children. Herd immunity does not guarantee protection for unvaccinated children. If you live in an area with low immunization rates, your child will not be protected through herd immunity. Further, herd immunity does not protect against all vaccine-preventable diseases. For example, tetanus is a serious disease caused by germs found in dirt, dust, and soil. It does not spread from person to person. Any child who are not vaccinated against tetanus will be at risk. Even the minor cuts or wound that has a tiny bit of soil in it can cause an infection. Over 10% of children and adults who get tetanus will die, even with the best intensive care. Vaccines also protect future generations. Just like we are no longer at risk of smallpox, thanks to vaccines, in the future we may be able to wipe out other diseases, for example, polio and measles, or even this pandemic. Ladies and gentlemen, vaccines are a very powerful tool in our fight against COVID-19. However, following recent reports of a series with extremely rare side effects of blood clotting from 2 of the vaccines, some of us may be scared and doubting if the vaccines are really safe to use. We're certainly concerned about the risk of vaccination. But it is also important to keep in mind the risk of COVID-19. The risk of serious adverse reactions for vaccination is much lower than the risk of serious disease or even death as a result of infection with COVID-19. This is why WHO strongly recommends vaccination against COVID-19, starting with people in priority group such as health workers, older persons, and people with underlying health conditions who are more exposed to infection and at higher risk of serious illness and death if they become infected with the virus. The number of cases of COVID-19 in Malaysia are currently rising, and now the new variant known as Delta variant has spread in several states in this country. Vaccination, combined with other public health measures, is the best way to protect yourself and help control the infection rate. This is why we must take the vaccines when our turn comes. Meanwhile, everyone who's vaccinated or not should continue to adhere to public health measures, such as physical distancing, wearing masks, hand and respiratory hygiene, and ensuring good ventilation by opening windows and doors where possible. COVID-19 is still a threat to people who are unvaccinated. People who get COVID-19 can become severely ill, which could result in hospitalization, or worse, they have to rely on ventilators to help them breathe while being in comas. Some people have ongoing health problems several weeks or even longer after getting infected. Even people who did not have symptoms when they were infected can have these ongoing health problems. Yes, there is still a lot that we have to learn about COVID-19 vaccines. We don't know how long protection lasts for those who are vaccinated. But what we do know is that COVID-19 has caused a very serious illness and death for a lot of people. They lost their friends, their family, because of this virus. If we get COVID-19, we also risk giving it to the loved ones, who may get very sick. Getting the vaccines is a safer choice for us. Before I end my speech, I want to stress that vaccination is crucial for all of us. We may not realize it now, but we are helping our country to lower the risk and daily cases. We also don't know how many lives we've saved by staying inside, following the CDC guidelines, and of course, by getting the vaccines.